Good afternoon and welcome to the programme. I'm Louise Newton.
And I'm Hannah Roman, and we are DID Leicester with today's news. A national report published today has highlighted the main health problems facing doctors in Leicester. High and average rates of diabetes, heart disease and high blood pressure are putting strain on local healthcare teams who are already struggling with the current shortage of medicines. Other conditions such as COPD, stroke and mental health problems such as bipolar disorder are also flagging as high and are further adding to the burden. A council representative has said that they are treating the drugs shortage as a high priority, commenting that today's report will guide the trust towards drugs providing health prevention, in particular aiming to reduce cardiovascular disease. This isn't to forget those drugs needed for common problems such as treating infection and pain. More on the story as the situation progresses.
Thanks, Hannah.
Anytime, Louise.
Now in other news. Local drainage company HMG CoA's reductase inhibitor limited, known commonly as simvastatin, celebrated 10 years of keeping our city's pipes free from blockage today. The company have successfully reduced burst pipes and the number of people left without supply due to blockages has significantly reduced. The company claimed to be the #1 in prevention of pipe-related problems in the country, and figures support this, despite a recent spate of complaints. The company, who refused to serve pregnant women citing safety concerns, recently had some complaints after customers found that their pipes had more air than usual following an unclogging. This caused some rather alarming and embarrassing noises for those affected, losing the company vital customers at an already tough financial time. This loss comes after last year's scandal, where customers were left feeling tired and achy after simvastatin asked them to chip in with the fitting of the pipes during periods of understaffing. These complaints spark concern regarding whether the company should continue its intervention work, but it has been confirmed that primary prevention of blockage is still the preferred option and they will continue to be used widely in Leicester. Back to you, Hannah.
Thanks, Louise. Now continuing with the city's financial district, as has been announced that a small business, Propanol Limited, went into administration yesterday. Bosses blame the recent move of Riaz Corporation into the area, which attracted more customers following better customer satisfaction and results. Particularly popular amongst the Leicester population, customers said that the company seemed more effective with shorter queues reducing blood pressure. One customer is quoted as saying that joining Riaz has improved her husband's health after he suffered from a heart attack last year. Let's go to Riaz with a happy customer.
Hi there, Hannah. I'm Riaz Corporation with one of their brand new customers. Let's see what he has to say. Back to you in the studio.
Maybe not so happy then. Well, let's just hope this is a small glitch and Riaz will be here to stay. Back to you, Louise.
Thanks, Hannah. A worrying story now about a group of students and staff at Leicester University from the Clinical Methods block who have been suffering from a range of conditions. Due to long working hours and seeing a high volume of patients with vague symptoms, the students have come down with insomnia, neuropathic pain, tension headache and IBS. Teaching this unfortunate cohort has resulted in tutors suffering with depression and urgent incontinence. Fortunately, pharmacist of the Red Stream, Kasir Mahmood, treated all with amitriptyline to great benefits, although some students have been left drowsy and unable to talk due to dry mouth, resulting in poor marks in the end of block assessment. Mr Mahmood declined to comment.
On to brighter news now, Louise.
Excellent.
Local band Morphine played a charity gig yesterday at a local hospice in Leicester to cheer up the patients. The band reported pretty good nerves before performing in this hard-to-please crowd, who last week booed girl band Paracetamol off stage, with one man saying, "They made no impression on me." Nevertheless, Morphine were a complete success. One patient said, "They hit the spot perfectly," with others saying they just listened to one song before feeling much better. Morphine are a versatile band and pride themselves on relieving fans of their woes. A couple of residents found the performance overwhelming and were unfortunately left nauseous. Morphine's #1 hit, Constipation, was paid as an encore.
I quite fancy listening to Morphine.
They're on my playlist, Louise.
Sports news now. News we've all been waiting to hear. Local tennis star Sam Asprin blocked rival Andy Cox last night in this year's semi-final of the NSAID tennis tournament. Well known for his anti-platelet ability, his domination continues today as he knocked number 2 seed Brian Payne out of the competition, giving Leicester great hope of a 2012 champion. I don't know about you, Hannah, but Asprin certainly brings my temperature down.
Yes, Louise, I think it gets everyone's heart beating. Continuing with sports news now, local team Metformin drew 1-1 with Inchlin, proving they could stay in play despite concerns whether the two local teams could compete. There were some breaks in play for Metformin players to use the toilets and complaints from their rivals about bad breath. Some players, unwilling to take the recommended B12 vitamin supplements, had to be substituted during the game due to their inability to feel their feet and the ball. However, it wasn't all on the Metformin team, and there was prolonged injury time following a number of hypos on the Inchlin side. Metformin fans had previously voiced concerns that their players, famed for rapid weight loss, weren't ready to face the heftier Inchlin team, yet this change in weight appeared to benefit the Metformin team rather than vice versa. It will be interesting to see if the fast-improving Metformin team makes the top of the DM2 league. Over to Riaz with the weather.
Thanks, Hannah. Well, it's bad news, folks. Following Hurricane Penicillin last week, which devastated some towns, it left some residents with diarrhea, a rash, swollen angry faces, and in some rare cases, death. Hurricane erythromycin is also set to hit. The storm is a macrolide on the Beaufort scale and is set to wipe out the towns of chlamydia, syphilis, pneumonia, cystitis, diphtheria, listeriosis, and even legionnaires. We are advising the residents of these towns that GI upset, reversible hearing loss, and drug interactions may also occur. Now back to you in the studio.
Oh gosh, button down the hatches, everyone. And finally, our pick-me-up news story of the week. A.D. Renlin is this week's Good Samaritan here at DID Leicester after saving the lives of 2 local residents. It was Mr. Adrian Renlin who rushed to the rescue when his neighbour suffered a cardiac arrest whilst out gardening late last week, and his actions saved the gentleman's life. This was followed by his heroic actions at a family birthday party when his niece accidentally ate a peanut to which she was severely allergic. All the family were grateful for Mr. Renlin's presence, not present, saying he was quick to act. So well done to Adrian. You'll be receiving our mystery gift in the post very shortly. Well, that's all we've got time for.
I've been Hannah.
And I've been Louise. See you next time.
Goodbye.